Welcome from Caregiver Cloud to our course on medical emergencies, Heimlich Maneuver. The Heimlich Maneuver is a procedure used on a person when they are choking due to something that is lodged in their windpipe. The goal of the Heimlich Maneuver is to dislodge the trapped object, usually food. Every healthcare professional should know how to perform this maneuver. When a foreign object becomes lodged in the throat or windpipe, the flow of air is blocked, resulting in choking. In adults, choking often occurs because of food lodged in the windpipe. If the air is cut off for too long, brain damage can occur. It is important to treat choking as an emergency situation and know the proper steps to administer first aid as soon as possible. A choking person can have a total obstruction of the airway, which will result in no sound moving in or out of the airway. It is also possible to have a partial obstruction, in which only some of the air is able to move through the airway. With the partial obstruction, you may hear a noisy sound when the person is breathing. Both of these situations are serious and further first aid measures are needed. The universal sign from a person that indicates they are choking is their hands to their throat. It is very important to determine if a person is a choking victim in an emergency situation. When a person is choking, the first attempt to signal for help is done by the victim placing both of their hands on their throat. The person usually will also have a desperate or panicked look on their face. If a person does not give a signal that they are choking, it is important to recognize other signs that may indicate that choking is the problem. Their inability to talk or cough forcibly can indicate choking, so be sure to observe your patients while they are eating. An absence of sound from the airway or noisy breathing can be a clear sign that the airway is fully or partially blocked. When the airway is totally obstructed, the choking victim will not be able to speak or move any air in or out of the airway. You may also notice that the choking victim's skin, lips, and nails may turn a darker color than normal when the airway has been cut off for a short period of time. Eventually, a choking victim will lose consciousness when oxygen has been cut off from their brain for too long. Performing abdominal thrusts to dislodge food stuck in a person's airway is what makes up the Heimlich Maneuver. The Heimlich Maneuver is the first step that should be taken for a choking victim. If another person is available to help, send them to call for assistance while you perform the procedure. The Heimlich Maneuver is the first thing you should do for a choking victim if you are alone. Do not call for help until you have attempted this procedure first, because every second counts when the airway is obstructed. If the Heimlich Maneuver is unsuccessful in dislodging an obstruction in the airway, call 911 and perform first aid as indicated. When performing the Heimlich Maneuver on another person, you should stand so that you are behind them. If a person is choking, have them stand up on their feet while you stand behind them. If a person is unable to stand, you can perform the Heimlich Maneuver while they are sitting, but the required moves may be more difficult to perform and can be less effective. In order to effectively perform the Heimlich Maneuver, you should stand behind the choking person so that you are able to wrap your arms around them and perform abdominal thrusts. When standing behind a person to perform the Heimlich Maneuver, your hand should be in a fist. When performing the Heimlich Maneuver, you should stand behind the choking person with your arms wrapped around them. Your dominant hand should be in a fist, with your other hand flat across your fisted hand. Be sure to keep your thumb wrapped into your fist so that you do not further injure the person while performing the Heimlich Maneuver. Keep your feet spread shoulder length apart so that you are prepared to catch the choking person if they should lose consciousness, and this allows you to have the most amount of strength to perform effective abdominal thrusts. When performing the Heimlich Maneuver, your fisted hand should be placed just above the belly button of the choking person. The placement of your fist just above the belly button will help provide an increase in pressure in the abdomen and chest during the abdominal thrust, enabling the object to be expelled from the airway. While performing abdominal thrusts on a choking person, the motions of the thrusts should be quick and upward. When performing the motion effectively, you should feel like you are trying to pick the person up off of the ground. When performing the Heimlich maneuver, if the obstruction does not become dislodged after the first abdominal thrust, you should repeat the abdominal thrust 5 times. The abdominal thrusts should be performed 5 times before moving on to another technique. Each thrust could move the obstruction slightly, and a series of thrusts may be required to entirely remove the object from the airway. Never give up on the Heimlich maneuver after one attempt. The 5 thrusts should be done in quick succession to be the most effective. If an airway remains obstructed after 5 abdominal thrusts, the next step to perform is 5 back blows. A back blow is a technique that is recommended by the American Red Cross for choking victims. You should use a 5 and 5 approach, which is 5 abdominal thrusts, then 5 back blows when someone is choking. A back blow is performed by using the heel of your hand against the person's back between the shoulder blades. You can alternate back and forth between abdominal thrusts and back blows until the airway is clear, or further first aid is indicated and help arrives. You will know if the procedure has been successful when the person starts to choke and coughs up the obstruction from his airway. If a patient becomes unconscious during the Heimlich maneuver, you should check for a pulse and start CPR if there is no pulse. An unconscious person could indicate the loss of a pulse or respirations due to the lack of air getting to the rest of the body. If you know that a person has choked, always try the Heimlich maneuver first to clear the airway. If the Heimlich is unsuccessful and the choking victim is now unconscious, stop the Heimlich maneuver and call 911. The highest priority is getting the airway cleared for a choking person, and if the Heimlich maneuver is unsuccessful, then further emergency intervention may be necessary. This concludes the Caregiver Cloud course on medical emergencies, Heimlich maneuver. Copyright 2016, all rights reserved, Caregiver Cloud LLC.